All right. It is 10 minutes after the hour. Make sure that you have joined 310316, and we are ready to get started. Here we go. So welcome to Fall 2024 Trivia. Before we get started, we just wanted to thank you for being here. I think we've been at it for 2 years now, so that's quite a feat. This is presented by the predentmentormap, created by students of dentistry. We have Brendan on the line. I don't know if you want to say a few words, Brendan.
Yeah, real quick. Thank you. Thank you. Prudent Mentor Map is a free resource for pre-dental students to get some insight and data and even match with a mentor, a current dental student mentor at every dental school in the United States. We've had it on Canada now and we're expanding. We're actually just rolling out an ambassador program in the coming month or two, which would be really cool for what's to come. This is a great resource to make the process applying to dental school less stressful, as we all know, as we go through this journey and as a pre-dental, dental, and a dentist now, right? Or specialist, can be stressful at times. So that being said, thank you guys for joining tonight. Hope you have some fun. Thank you so much for Dr. Walter putting this together and hosting us tonight. And happy Halloween coming up.
Yeah, happy Halloween. So speaking of, if you are new to the game, we have 15 multiple choice questions to test your oral pathology skills. Time and accuracy are important. So you will have 20 seconds per question, and the quicker that you answer the question correctly, the more points that you will get. So it is important not only to answer the question correctly, but also quickly. The theme for Halloween is something truly spooky, infectious disease. So all of the questions tonight are contagious. So we do want to let you know that you should follow us on social media if you haven't already. This is everyone involved, the students of dentistry, Pre-Dent Mentor Map, Dose of Dental Podcast, Top Dental Practices, Elite Dentists, and of course myself on Instagram and YouTube. That will be your place to make sure that you don't miss any future trivia nights. So be sure that you like and subscribe. So just as our usual practice round, what option best describes you? This is not scored or graded. This is just so you can get used to the app. So are you a pre-dent, pre-med, or other? Are you a dental medical professional student? Are you a resident, or are you in practice? This is one of the last times Dr. Gallagher will say that he's a resident. Pretty soon he'll be green. So we've got no practitioners other than myself, but we've got 4 residents, some dental students, and some pre-dents. Excellent. So pre-dents, some of these probably are known from biology courses, so you are in the mix for sure. And then you'll learn a few things as we go along. So let's start with our first question, which is what genus of fungus causes thrush? So is it albicans? Is it mucormycosis? Is it histoplasmosis? Or is it candida? This is a picture of thrush, which has a proper name that I'm almost said, but would give the answer. All of these are part of fungal names, but candida is the genus. Candida albicans is the most common cause of candidiasis in the oral cavity, or a candidal overgrowth, and that causes thrush, which is the pseudomembranous candidiasis. That causes wipeable white plaques that you can see throughout the oral cavity. Candida is the genus, albicans is the species. So let's see how we're scoring so far. We got a tight game. Lots of people got that. We got Asham in the lead with 940 points, but everyone is nipping at his toes. A 1-point separation between second and third, but it is anyone's game, as we all know. So let's go into number 2. What virus causes hand, foot, and mouth disease? Is it the Coxsackie virus, the human herpes virus, varicella zoster, or herpes zoster? And here is a photograph supplied by a friend of mine. This is actually her son who had hand, foot, and mouth disease. You see these tiny red dots on the foot. This was indeed Coxsackie virus. Coxsackie virus is the virus that causes hand, foot, and mouth disease. Very good. The vast majority of people got that one correct. Let's see how we shape up. Asham solidifies that first place, and we've got a shakeup down below with AAA and Tugsy in second and third, respectively. Moving right around to number 3, which of the following is not an antifungal medication? Nystatin, amphotericin B, terbinafine, or fluorouracil? All of the above are an antifungal medication except one, which is the outlier. The outlier is a chemotherapeutic medication called fluorouracil. This is a disruptor. It gets replaced during tumor growth and causes tumor destruction. The other 3 are indeed antifungal medications. Very good. We're doing great tonight. Everyone is on point. But let's see if how quick we are on the dial. Excellent. Asham and AAA holding their spots, but James entering the leaderboard, and Marie is up 7 places. Way to go, Mary or Marie. Number 4, what type of organism causes scarlet fever? Is it a virus, a bacteria, a fungus, or a parasite? What organism causes scarlet fever? And here we have a characteristic red cheeks and rash of scarlet fever, and the quote-unquote strawberry tongue that has a white coating where the red inflamed papilla are showing. Indeed, it is bacteria. A beta hemolytic streptococcal species causes scarlet fever. So it is a bacterial organism that causes scarlet fever. And we've got 4 players with an answer streak of 4, and our leaderboard is solid so far, but the game is just starting. We're not even a third of the way in, so it's still anyone's game. Number 5, owning which animal puts you at risk for tularemia? And here's a picture of tularemia. Is it cats, dogs, rabbits, or birds? The picture that you're seeing here is glandular tularemia, usually after a scratch or a bite from an infected animal, and that causes lymph node swelling and glandular swelling, which you can see very clearly in this photograph. The animal that causes tularemia is a rabbit. A rabbit. Cats, dogs, and birds do carry other diseases, but rabbits are the carriers for tularemia, as well as some mice and some rodents. But rabbits are associated with tularemia. So be careful to all you rabbit owners out there. If that sounds familiar, but we'll do that. James with the upset, taking first place, and CD entering the leaderboard in second place. And we have James with the highest answer streak of 5. That's a perfect score. James, you're on fire. If that question sounded familiar, it was taken out of a YouTube video. Are our pets trying to kill us? Perfect for Halloween. If you want to review that and all of the other scary diseases that you can get from your pets, check that out on my YouTube channel. Question number 6, in which state are you most likely to get coccidiomycosis? And here's a picture of coccidiomycosis. Is it California? Is it Ohio? Is it Maine? Or is it Florida? One of these states is endemic to coccidiomycosis, which you can see here, a large fungal organism with lots of little tiny baby buds inside of it, and it is California, a hard one. This has the least amount of correct answers. You might think it's Ohio because of my background, but Ohio is more endemic for histoplasmosis. Coccidiomycosis, or valley fever, has a different distribution, which I'll show you in 1 second. But first, up 6 places, David is the highest climber, and we have a new first place. This is a lot of switching up in the leaderboard with CD thwarting James in first place. This is the distribution of coccidiomycosis, aka valley fever. It is the southwest, including California, Arizona, New Mexico, Texas. It does stretch northward, but not to Maine, Ohio, or Florida. Other endemic specific fungal infections, including histoplasmosis and blastomycosis, can affect these areas, though if you live in Maine, you're probably pretty safe from those. Moving right along, which of the following is caused by a herpes virus? We're at the halfway point. Here's a nice picture of a herpes smear. Is it Kaposi sarcoma, shingles, mononucleosis, or all are caused by human herpes viruses? Human herpes virus is a family of viruses that can cause a number of conditions. All of these are caused by the human herpes virus. Kaposi sarcoma is caused by human herpes virus 8. Shingles is a varicella zoster, which is a human herpes virus, and mononucleosis is caused by EBV, which is also a human herpes virus. So all of these are caused by the family human herpes virus, or HHV. CD with a streak of 7 answers in a row, and Tugsy back in our top 5. We are at the halfway point, but as we've seen already, there is lots of movement and lots of opportunity to claim your spot on the leaderboard. So let's head into the second half. Number 8, what type of organism is Ganglionema pulchrum? Is it a virus, a bacteria, a fungus, or a parasite? Ganglionema pulchrum. What kind of organism is Ganglionema pulchrum, which can infect human beings? A virus, bacteria, fungus, or parasite? Get in your answers. It is a parasite. It is a worm. And I'll show you a picture of the worm in the lower lip. It can squirm around inside the oral mucosa. So I'll show you a picture of that. If you're a little squeamish, be careful after our leaderboard, but let's take a look at our leaderboard. Tugsy and Abraham moving up, with Abraham joining our top 5. Our top 3 are pretty solid so far, but perhaps someone is nipping at their tails and ready to take over. If you're squeamish, now is the time to look away. I'll tell you when you can look again, but this is Ganglionema pulchrum. You can actually see the indentation of that worm that has burrowed under the labial mucosa. Now, don't be worried. This is exceedingly, exceedingly, exceedingly rare, but it does happen from time to time. On to number 9, what type of armadillo is the natural reservoir for leprosy? Is it a 7, 8, 9, or 10-banded armadillo? That is the natural reservoir for leprosy, and we do see leprosy cases in the United States, mostly in the Southeast, where armadillos are native, specifically this type of armadillo, which is the 9-banded armadillo. And yes, the question number was a little bit of a hint. Question number 9, the 9-banded armadillo is the natural reservoir for leprosy. Taking a look at our scoreboard, Asham crawling his way back up to second, and we've got SWE or SWE as the highest climber, up 3 places, so maybe nipping at the leaderboard here. But let's keep rolling along to number 10, entering the last third of tonight's game. Number 10, which of the following is the most infectious? Is it measles, smallpox, SARS-CoV-2, or mumps? Now, to measure infection, they use something called an R-naught. R-naught is the number of potential infections caused by one infected person. One of these has a dramatically enlarged R-naught. Which is it? Well, it's measles. Measles has an R-naught of 18, meaning, or depending on the source, 16 or 18, meaning up to 16 or 18 people can become infected from one single infected person. Mumps is also pretty high at 8, and smallpox and SARS-CoV-2 are around between 2 and 6, depending on the study. But measles is one of the most infectious conditions that's out there, and why it's so important to get vaccinated. So not too many people got that. Let's see how that affected our leaderboard here. Wow, we got a little bit of a shakeup. James reclaiming second. Abraham, highest answer streak, and coming into a very close fourth with only 30 points separating Abraham from our top 3. Number 11, Koplik spots are observed in which condition? And let's take a look at those Koplik spots after this answer. But is it measles, smallpox, SARS-CoV-2, or mumps? Same options as last time. Koplik spots, a characteristic feature of this infection, it's measles. None of you were tricked from that back-to-back. It was indeed measles. Measles are commonly, Koplik spots are helpful in the diagnosis of measles. They are spots on the buccal mucosa that I will show you momentarily. But first, we got to see how things shake out. Wow, we have a shakeup in our leaderboard. Abraham, as said previously, now in second place, has joined the top 3 with Asham reclaiming the lead. But James, Tugsy, nipping at their heels, and I'm sure there's plenty of you out there that are just itching your way up to the leaderboard with some challenging questions ahead. Let's take a look at those coat block spots. You can see on the buccal mucosa, all of these spots are pretty characteristic of measles. Not something that you see very often, fortunately, due to high vaccination rates and herd immunity, but occasionally we do see breakthrough cases, especially in communities where vaccines are not prevalent. Number 12 is a true or false. Recurrent intraoral herpes simplex in immunocompetent patients only occurs on attached mucosa. Is that true or false? Now, a lot of people suggest that these are wrongfully diagnosed these as aphthous ulcers, but it's actually recurrent intraoral herpes simplex or cold sores in the mouth. A lot of people get recurrent herpes simplex of the lip, labialis, but in the oral cavity, recurrent intraoral herpes simplex is on the gingiva only, the attached gingiva and palate only. Aphthous ulcers do not occur on attached mucosa, and recurrent intraoral herpes simplex doesn't occur on unattached mucosa, which is very helpful in the differential diagnosis. So recurrent intraoral herpes simplex, or intraoral cold sores as I sometimes call them, to help patients understand, only occurs on attached mucosa like gingiva and palate. So most people got that wrong. Let's see how that affected our leaderboard. CD back in the top 3 and Tugsy joining the lead. We've got a very tight game here with lots of movement. We love to see that. Makes it exciting up until the end. So we've got a tight game. Who's going to come out on top? Well, only a few questions left, so let's see how it shakes out. Number 13, multifocal mucus patches are a component of which stage of syphilis? Primary, secondary, tertiary, or congenital? Here's a picture of a mucus patch that I came across in practice. This was only one of them. But is it a primary, secondary, tertiary, or congenital manifestation of syphilis? It is secondary syphilis. A chancre, which is the primary site of inoculation, a very large ulcer, is single and solitary where the infection occurs. Mucus patches can be multifocal and can occur outside of where the infection took place. Tertiary, you get very large guma or very large ulcers, and that can include communication with the sinus. And then congenital has its own kind of group of manifestations, but most of us got that. It is secondary syphilis. Tugsy pulling into second. AAA back in the top 5. And 3 people not even on the board have an answer streak of 3. So I think we've got a tight game going into the last 2 questions. So let's look at the penultimate question. What virus causes oral hairy leukoplakia? Now, a lot of people say oral hairy leukoplakia for white change, but this is a very specific finding on usually the lateral tongue as vertical white lines in certain immunosuppressed patients, patients with HIV/AIDS, or patients with solid organ transplant. They have infection of the Epstein-Barr virus, or EBV, on the side of the tongue that leads to these changes. Be very careful calling something oral hairy leukoplakia outside the setting of immunosuppression. It is not a synonym for leukoplakia. It's a very specific circumstance of EBV infection in patients that are immunosuppressed. So I'm glad most people on the call knew that. And if you didn't, hopefully you learned something. Abraham back in the top 5, but our leaderboard looks pretty solid going into the final round, but 3 players with an answer streak of 4. We'll see how this shakes out. We've got 1 question left. Are you ready? Let's see what you got. Which of the following results in the most deaths annually? Is it leprosy, measles, tuberculosis, or HIV? And this is worldwide, by the way. This is not just the United States. This is worldwide. Leprosy, measles, tuberculosis, or HIV. The most deaths annually. It is tuberculosis, or TB. It does cause the most deaths annually. And in a lot of places throughout the world, it is a very serious issue and a very infectious and contagious process that can lead to death. Something a little spooky going into Halloween. So before we say who the winners are, we do want to thank you once again and remind you to follow us on social media so that you don't miss any future trivia nights in the future. Any final words, Dr. Gallagher? Uh-oh, we're muted. Let me see if I can. There we go.
Awesome. Thanks. Just want to thank everyone for coming out. If you're a current dental student, if you'd be so kind to sign up for your school on the Predent Mentor Map, we'd really appreciate that. We have a lot for you to come over the next couple months as well as a couple years. And Dr. Roth, good to see you. We got to get together again. I'm going to a tough rotation actually starting Monday, but we will. We will. It's one of those years, you know?
Absolutely. We got to have an Oktoberfest going into October. Although Oktoberfest is in September. But
True,
for
true,
sure.
true.
All right. Let's see our winners, shall we? Let's see what's going on. And our podium in third place with 9,000 points, Tuxie. Excellent. CD in second. And in first, who is it? Asham in first with 11,000 points. Very good with AAA and Abraham as our runners up. If you are in the top 3, be so kind as to let me know in the chat. Send me your email in the chat, and we will see you all in winter of this year.